Good morning, everyone, and welcome to Morning Sign-In on UCLA Radio. This is Laura.
This is Nicole.
And before we get started, we want to say just up front that we're not medical professionals. We're students who care about health literacy, and so today's show is meant to share general information, raise awareness, and encourage just thoughtful conversations about health and not give medical advice. If anything we talk about today resonates with you, the best next step is always to speak with someone qualified, a good professional who knows your personal medical history, and our goal isn't to diagnose or scare anyone. It's to make these complex health topics more understanding and less intimidated. Yes. So today we're going to be talking about pancreatic cancer. So I guess to start this off, what does the pancreas do?
Okay, so the pancreas, can you hear me?
Yeah, I think so.
The pancreas sits deep in your abdomen behind your stomach, so you can't really feel it, which is part of the reason why pancreatic problems are hard to catch early, just because it's behind all your other intestines. And if you're doing per se surgery or something like that, they would have to physically I think lift up your organs to see if there's anything wrong with your pancreas. So it's very hidden.
Oh man, it's pretty small, right, compared to your other organs?
Yeah, extremely small.
Yeah, that's interesting. So I guess what the pancreas actually does, you're probably wondering, why do we even have this organ?
Yeah.
Or at least I am. But, okay, so it has, two main things that it controls or does. And so number one is it helps you digest food. So the pancreas makes digestive enzymes, and these enzymes break down fats, proteins, and carbs, and then helps your body absorb these nutrients from food. If this isn't working well, people might notice, bloating or, greasy or pale stools, kind of.
Yeah.
Yeah. And unexplained weight loss might be a symptom of this, feeling full too quickly. Number two is it controls your blood sugar. So the pancreas also makes hormones that include insulin, and insulin is what helps move sugar from your blood into your cells. And this keep your blood sugar at a healthy level, and when the system breaks down, blood sugar can spike. And so some people develop diabetes with this, and others end up feeling fatigued, thirsty, or weak when this system ends up failing. Yeah.
This is very connected to diabetes.
Yeah. I wonder, it must be, I guess, difficult to diagnose pancreatic cancer if you're already showing symptoms just for something more
manageable.
Something more manageable, something more easily diagnosed. Yeah, so pancreatic cancer interferes with both digestion and blood sugar, and I think, there's kind of, interconnection, it affects so many different things. You can feel so many different symptoms and not really know what the issue is and have these other diagnoses, like diabetes, to kind of, I don't want to say cover it up, but kind of
compensate.
Compensate for it. So I guess, moving on from what the pancreas does to what pancreatic cancer is.
Cancer in general is just an overgrowth of certain cells, but in the pancreas, it's when the cells in the pancreas starts growing out of control. So instead of dying and being replaced normally, the cells multiply and form a tumor and interfere with how the pancreas works and manages itself.
Interesting. So a normal body just makes new cells and gets rid of old / dead ones, right? Yeah, that's super interesting. I always kind of pictured these tumors growing just out of control, multiplying.
Yeah.
It's really scary. But normally, pancreatic cancer is especially dangerous because it starts so deep in the body. It's behind all your organs, and it's kind of hidden, so these tumors can grow quietly for a long time without, any symptoms, right? Once you start feeling symptoms, it's oh, man.
You're done.
not done.
You're not done, but it is really hard to, do chemo and everything because it is such a hard part of your body to notice. And a lot of people, when they do get diagnosed with pancreatic cancer, it's it's in the end stages. So if you do get it caught really early, you're very lucky.
Definitely. And I feel this is especially scary because it kind of starts off as such mild symptoms. I feel I definitely have a little bit, I don't want to say I'm a hypochondriac, but I feel little symptoms I'm always oh man.
Yeah, I'm I'm just scared.
No, literally, I'm always so scared. But I think it's definitely good to be aware of these issues in case they get worse.
Yeah.
But these early symptoms are so vague. They include things like fatigue, stomach issues, or weight loss, which don't really scream cancer, so people
Yeah.
usually kind of just dismiss it.
Yeah, these symptoms can easily be like put off as like stress or not eating enough or not getting enough nutrients.
Mm-hmm. Definitely. And I think by the time it's found, it might have already spread to your other
Yeah.
organs, which is really bad. Oh, a little fun fact I wrote down, about 9 out of 10 cases are a type called pancreatic ductal adenocarcinoma.
Carcinoma, yeah.
Carcinoma. I'm not sure exactly what that is. I might have to look that up. Oh, I
It's-
literally wrote it down.
It starts it starts in the cells that line the ducts carrying the digestive enzymes. These ducts are essential for digestion, so problems show up system-wide, which is why like it can be misdiagnosed as something different. That's not pancreatic cancer.
I see. So this is kind of more like dealing with the nutrient side of things, like digestive. Okay. Okay, so I guess, okay, interesting. So it gets diagnosed late because there's no routine screening test like there is for breast or colon cancer. So doctors usually find pancreatic cancer after symptoms appear, which we already said is like when it's advanced. So I guess now that we kind of know what pancreatic cancer is, the next question becomes like, what does it feel like? Like, why do so many people, I guess, miss these early signs, despite like it being so vague, I guess?
Yeah, because I guess as we said beforehand, it can be pushed off as just like stress, but some of the warning signs are unexplained weight loss, like losing weight without even trying, even though your appetite hasn't changed. Like, you might lose your appetite and feel full too quickly, or you might eat less or usual, or, oh my god, you might eat less than usual, or feel full after a couple, like, you might feel full.
You know what this reminds me
after a
of?
couple bites. Yes.
You know, like, there's, like, worms in your
Yes,
stomach?
the tapeworms.
Dude, I always get scared of that. I'm like, oh, man, like, what if there's a worm eating all my food right now? But I guess there can be many explanations for that, then, if this is
Yeah.
also I wonder why it starts feeling... It's just because it's not digesting it, I guess?
Yeah, I don't think it's getting absorbed.
Oh, okay, I see. Wow. Okay, that's definitely... Yeah, that's something I try to look out for. Like, if I'm, like, feeling super hungry after eating, I'm like, uh-oh. The worm. Anyways, what other symptoms are there?
So your digestive system, of course, because it does like attack that. So you might feel bloated, nauseous, or gas, or stools that are greasy or pale, or float. And this happens because your digestive enzymes are not working properly, and you might feel like abnormal abdominal discomfort and a vague ache or pressure in the upper abdomen. Or these are the more concerning symptoms, like once the cancer has progressed, which a big one is jaundice, like yellowing of the skin or eyes, dark urine and pale stools, itchy skin, and stuff along those lines. And you might have pain in the upper abdomen or back, and sometimes it's worse when you're laying down, and you can have nausea or vomiting, or diabetes, especially in adults over 50 who suddenly develop diabetes without weight gain. And the symptoms for vomiting can look like acid reflux, gallbladder problems, stress, IBS, and normal aging.
Yeah. So that's like why it's so hard to diagnose. Like,
Yeah.
these like digestive issues kind of just show up as like nausea or like...
Yeah, or like very normal issues
Yeah.
that can be passed off.
I think the diabetes point is really interesting though. Like, if you're developing diabetes past age 50, but you kind of, I don't know, like you're not eating a ton of sugar and
Yeah.
like, I don't know. I think that is definitely a more blaring sign than some of these other ones. I guess jaundice as well.
Yeah, jaundice
That
is
sounds
very...
really- yeah.
That's like one of the big symptoms that you can tell that someone has like pancreatic cancer, because they have jaundice.
Oh, yikes. I wonder how like yellow their skin gets. Like,
It gets really yellow.
oh man, I know like there's a medicine that causes like your skin to turn like more orange as well. Like, my doctor once showed me, and it's like you like take it's like some
Is it
imbalance.
antibiotic?
I don't think it was an antibiotic. I forgot exactly what it was, but it's interesting how these kind of imbalances can show up in the pigment of your skin.
Oh.
So I guess who's at higher risk? So age is definitely a big factor. So pancreatic cancer cases occur in people over 60 most of the time.
Yeah. And smokers are about twice as likely to develop pancreatic cancer, and it also, as we talked about last week, can develop because of your genetics
Mm-hmm.
and your family history. So having a first-degree relative with pancreatic cancer increases the risk because genetics.
Yeah, I guess that makes sense, huh? And then there's chronic pancreatitis, sorry. So if you're already having problems with your pancreas, like long-term inflammation.
Or alcoholism.
Oh, yeah, alcoholism. What else did I write down? Gallstones or genetic conditions can also cause this.
And people who experience diabetes or are obese.
Right, because obesity is linked to more inflammation in the body. So I guess just inflammation,
In general.
yeah, leads to increased risk factors with cancer. Yeah, so quit smoking, guys. Eat healthy.
Yeah, don't drink too much.
Yeah, exactly. So how is this pancreatic cancer diagnosed? It seems pretty tricky.
Yeah, because there's no like routine tests. Like you can get a mammogram for like breast cancer, but for this, since it is so like in the body, and you wouldn't want to get like a surgery without like knowing why and like putting that unwanted pressure on your body.
Yeah.
It is very hard because doctors don't usually start testing for it after the symptoms. They start testing for it after the symptoms appear. So they listen to symptoms and your medical history, and they do imaging tests, including like CT. Is often the first major test, and it's basically like all these machines that we're talking about is basically like X-rays, and they use like magnets to see what's inside your body, like
Right.
the wavelengths.
Yeah, I guess that can show a lot, right? Like they can detect like fluids that shouldn't be there. So I guess step 3 after imaging tests would be blood tests.
Yes.
Where doctors kind of look at liver function tests, especially if you are experiencing jaundice, and tumor markers. That's something I've been really interested in lately, like biomarkers for diseases. Because I know, like, with a lot of autoimmune diseases as well, like, they're only diagnosed with, like, these biomarkers.
Yeah, like there's a certain thing that, like, maybe it's higher or lower that you can tell that, oh, this person definitely has, like, this thing or this thing. Like sickle cell, you can tell because if you look under a microscope, you can see that their blood cells are curved. Or
Right, I think it's like they have, like, a little...
It's like a moon shape.
Yeah, it's a moon shape. I think it's really interesting because, like, you could have just an imbalance of, say, like, a complement, like C3, and it'll mean you're more likely to have, like, an autoimmune disease. Or, like, they test probably your antibodies in that case.
That's true.
And I think with cancer, like, they probably test antibodies a lot with cancer as well because when you have cancer, you can't develop those antibodies.
Yeah.
Very interesting to think about these blood tests because there's not, like, there's not a test like, oh, like, do I have pancreatic cancer?
Or not.
Yeah, it's just like all like clues.
Yeah, in surgery.
Definitely. So tumor markers can be elevated for other reasons too. They're supportive evidence, not proof. And I think that's like the main takeaway with this is like, I'm sure they're developing a lot of biomarkers. I wrote an article last year in like the spring about new lupus biomarkers. And one of them was like in the digestive tract. So like testing like your gut microbiota can like show that you have or are more susceptible to having active disease, which I think is probably similar in like all of these diseases. Like just looking for new biomarkers, I think that's a very emerging technology.
Yeah, or symptoms that might not that can be passed as like extremely normal, like having the common cold.
Yeah, that can definitely I've heard so many stories of that just being the trigger for these kinds of things. So I guess, okay, after blood tests, step 4 would be getting a biopsy.
Yes.
Which,
take a small tissue sample from out of your body. So this is the only way to confirm cancer. This is how they can see under a microscope, like, if you actually have cancer or is it just, like, a mass that's just there and, like, what's it called?
Oh, I'm blinking. Oh, my gosh.
It's, like, not cancerous. It's just a cell. Like, it's just like a tumor. There's a word for it, but I forgot what it's called. But biopsies are often done with an endoscopic ultrasound or with a needle guided by imaging. So sometimes they might even put a camera down your throat to see.
Right.
And
so I think this one is like when they put you under, right? And they like kind of just like send a needle in through your back to get a piece of the pancreas.
Wow, I did not know that.
Yeah, because I know for kidney biopsies they do that. They like put you under anesthesia and like cut off a little piece of your kidney. So I assume they cut off a little piece of your pancreas with this. Yeah, a little bit scary, but you don't feel anything. Yeah. So then after this, stage 5 is staging with the cancer. So if cancer is confirmed, then doctors can determine how large the tumor is, whether it's spread to lymph nodes, and whether it's spread to other organs. And this kind of helps decide whether surgery is possible at this point, or like what treatments make the most sense.
Yeah. So whether that be chemo or lifestyle habits or surgery.
Right. All right, so let's take a little break and then we'll come back with prevention and early action items that you can kind of work on yourself to maybe try to prevent this, even though it's not, you can't prevent it. I don't know.
Yeah.
Okay. Anyway, see you soon. Hi everyone, we're back. So now we're going to talk about prevention and early action with pancreatic cancer.
So there's no guaranteed way to prevent pancreatic cancer, but there are ways to lower risk and, just importantly, catch problems earlier. So first thing, do not smoke or quit if you start.
Quit.
Please quit smoking. Smoking is one of the strongest risk factors, and quitting lowers a risk factor over time. So it's never too late to benefit from stopping smoking, because the body can rebuild those cells that you've been damaging for years by smoking.
Right. You can quit any time, right? So quit now.
Yes.
Yes.
And also, don't drink too much. Heavy alcohol use can contribute to you developing pancreatic cancer. And you should manage chronic conditions like diabetes. Take it very seriously and try to lower, I don't want to say lower your diabetes, but manage those symptoms.
Definitely. I think with alcohol use, I always kind of connected it to the liver.
Yeah.
Not the pancreas.
That is true.
Yeah. What organs does alcohol affect?
Definitely liver.
Yeah, definitely. Okay.
Brain, heart, liver.
Liver, brain, heart,
stomach.
pancreas, and stomach.
Yeah.
Definitely.
Increase your cancer risk.
Yeah, so drinking too much isn't good, guys.
Yeah.
Who would have known, guys?
And if you do have if you are diagnosed with pancreatitis, take it extremely serious, because you can prevent it from progressing to a worse state.
Definitely. So I guess kind of the overarching theme is to maintain a healthy lifestyle with all of this. So to have regular physical activity and a diet rich in fruits, vegetables, and whole foods. It's a little bit, easier said than done. But
Yeah.
I've definitely, I don't know, I struggle with that too. It's when you run out of time, it's kind of hard to cook.
manage. Yeah.
But I mean, UCLA, we're number one in food, right?
Yeah, but college food overall is just bad.
That's true. I feel like everything is processed in some way.
Yes.
You got to go to B plate.
You have to go to B plate.
Yeah,
every day and
three
get
times a
plates
day.
of food.
Literally, only the what's it called? The grilled chicken.
Only grilled chicken, rice.
Only apple flatbread.
I have not been to B plate in a year.
I feel like every single time I went there, I'm not on the meal plan anymore, but every single time I checked the menu, it was always something experimental.
Yeah, the portion sizes are so small, extremely small. You need to have full plates of everything.
It's fancy. It's fancy. It's oh, here's a strawberry taco.
Here's one strawberry.
One strawberry, yeah. It's bougie.
But some early action that you can do is, if you think something is wrong and your doctor is not taking you seriously, advocate for yourself.
Definitely, very easy. I feel like if you feel something is wrong, I know I've heard a lot of stories of medical kind of gaslighting. A lot of doctors won't or dismiss it, and especially pancreatic cancer sounds like something you can dismiss very easily.
Yeah.
As just
fatigue, bones hurting.
Yeah, fatigue. You're just tired or stressed. It is very easy to kind of dismiss it, but if you know that your symptoms are getting worse, you need to know that you can always ask questions, request a follow-up, share family history, and get a second opinion.
You don't one doctor.
Yeah.
People have different experiences, so one doctor might not know as much as another doctor about communities and stuff like that. So definitely get a second opinion, always.
Definitely. And I think this can be confusing if you're hearing too many conflicting opinions, but I feel like you have to kind of look around to find someone that really understands and is putting in their best effort to help you, because unfortunately, I've had some bad doctors, some bad ER doctors, and
especially at the emergency room.
Dude, definitely. Oh my gosh, there was this doctor at urgent care once, and he totally dismissed my problem, and then was oh, and you need to get this really expensive X-ray because you probably have walking pneumonia.
I'm
I was okay,
sure?
That's totally out of. That's not anything I'm concerned with. That's not why I came in. You just want that bag.
No, that is true. Certain doctors, I know certain medical companies will make checklists to diagnose someone with depression so they can push the medication on them. I'm actually learning about this in my sociology class. Yes.
Oh my gosh.
7 questions. Pfizer, allegedly.
Okay.
There's a 7-page checklist. And, you can check off the symptoms, very normal symptoms that someone might be experiencing, not wanting to get out of bed, feeling very, anxious. And
Oh,
it's
wow.
a matter of whether these symptoms are persisting and not like, oh, I'm just feeling that way like once. Like
Yeah.
if the symptoms are persisting, then yes, maybe they might need those medications. But like it's very like things that can be like checked off as like normal human feelings.
Yeah, definitely. And I feel like that sounds like a bit of a like almost different issue to what pancreatic cancer patients might feel.
Yeah.
Like if they're feeling the symptoms, but then they get dismissed as something else.
Yeah.
So, but like in that case, it sounds more like, oh, like you have the symptom once and then it's kind of blown out of proportion.
Yeah.
Yeah, I guess it's like interesting and important to be aware of both cases that your doctors might push both ways, but it's important to listen to like how you're truly feeling and be like, "Oh, like that's not really how I feel." Like don't let them
Yeah.
put like words in your mouth.
Exactly. And
Yeah.
especially if you are feeling like something's wrong, make sure that they note in your chart that they're like refusing to like test you for this certain thing or that certain thing, because like these things can be caught a little bit earlier if you do advocate for yourself.
Yeah, definitely. And I know like it's kind of sad that a lot of people kind of have to like rehearse the way they speak to doctors because they feel like they're going to get dismissed.
Yeah.
And I know a lot of women like their symptoms get kind of pushed to the side because it gets put on like menstruating.
Yeah.
And it's like that's kind of okay, like hormones, I guess, but I think I don't know, it's kind of crazy that that's like an issue still and that we're having to advocate for ourselves so strongly to get
Yeah.
our point across and like our feelings heard. But it's important that if you're feeling these symptoms that you do stick to your word and like, get opinions where you need them and, just keep a note. Like if you have symptoms that are getting worse and worse, it is always better to find a professional willing to listen to you.
Yes.
Yes. And if a doctor pushes you aside, it's not like,
It's not your fault.
it's not your fault.
Get a second opinion.
Yeah, exactly. Find someone else. So I guess like this is why awareness matters so much. So even without a simple screening test, knowledge and early action can kind of change the outcomes of this. So like if you capture this early on, you can benefit a lot more from it than
Yes.
later, which might, be
Yeah.
like a lot more of a traumatic experience.
Yes. And
So-
extremely more painful.
Yeah, definitely. Chemo does not sound fun. But so awareness helps people recognize these symptoms.
Mhm.
Like this is like making me learn a lot more about
Yes.
like what to look out for with this because I hadn't really thought about pancreatic cancer, TBH. But knowing about like family history matters, talking openly about, like what your family has gone through and kind of keep in mind the genetics and like new health changes is very important so you know what to look out for and speak to your doctors about.
Yes.
Yeah, so it helps like relatives get care sooner and it helps ask better questions because you know what to look out for too.
Yes. And yes, talking about this reduces stigma. And also a fun fact, pancreatic cancer receives much less research funding compared to the other major cancers, despite how severe it is.
Right. I wonder if this is just because there are less people that get it?
Yeah,
Is
or
it
there
more rare?
maybe that there's like not less people that get it, but like to the point like where when they catch it, it's like too late to the point where they can't like do medical testing or like use that person. I don't want to say as like a test experiment or like use their case as like, oh, we can experiment these drugs on this type of person when it's early to see if like the drugs do work on
That's true. It does
early
sound
stage.
difficult. Like I feel like that would be more motive to start research in how to detect it even earlier.
Yes.
But I also don't know how that would entirely work if it's, so hard to diagnose already. And if I feel like that would mean finding someone that had really early onset pancreatic cancer. But yeah, it's very interesting to think about. Definitely need more research funding in that and a bunch of other diseases.
Yes.
So health literacy, this isn't just about like memorizing medical facts. It's about like knowing when to pay attention to these symptoms and kind of know like what everything means for other people. It like creates empathy and more understanding, and it it helps you come up with better questions and know like when to speak up about these things.
Yes.
So that is the goal of our radio show here today, is to talk about these important subjects and kind of make them more digestible.
Yes.
And that hopefully we taught you a little something today.
Yes.
And we hope you will join us again next week, 9 a.m. Tuesday. to listen to another very interesting health topic. Okay, thank you everybody. Enjoy your Tuesday morning.